This is the Emergency Medical Minute.
This medical minute was inspired by a med error that happened at Vanderbilt University. You guys may or may not have heard about it. It was a couple months ago, but basically a patient was ordered Versed verbally for a PET scan. They ended up giving vecuronium instead, and the patient did end up passing away. So I thought I'd just talk a little bit about medication errors and what we can do to prevent them. So data from 2016 showed that medication errors were the third leading cause of death in the United States. There are estimated to be over 250,000 med errors per year, with 7,000 to 9,000 of those leading to death. And those are just the ones that are identified and then reported on. So it can occur at any step of patient care, really. The most common steps, about 50% attributed during the ordering and prescribing phase, and about 25 to 30% during the administration phase. So when asked about causes of medication errors, it's most likely because the nurse or provider was distracted or there was some kind of misinterpretation of orders. And due to the nature of the ER, we're at a higher tendency to have medication errors just because it's so busy, we're often distracted, not enough staff, etc. So there was one study that was done in 2017 of ER nurses. They found that 40% of the nurses there had witnessed an error within the past year. 20% were the ones that made that error, and then 17% of those were due to wrong medication or wrong dose being administered. 0% of those went reported per the nurses. When asked about the causes of the error, they said that over 90% had too much on their plate, excessive workload, and the other ones were being inefficient staff, and they were just exhausted or fatigued and just missed it. So how can we avoid these errors? So always consider your patient, go through your 5 rights, consider the patient's age, their weight, creatinine clearance, clarify or double check any doses. If it feels wrong or it doesn't seem right or it doesn't seem like it's on the right patient, always ask. Remain alert for high-risk medications, verify indications. Scanning really helps to reduce those, and then try to reduce or eliminate any distractions as needed. And then the other thing too is just be vigilant about reporting these errors. I know it's time-consuming and a little bit of a pain, even if it's a near miss. It really helps us to identify any cracks that we can fill in. If you've had an issue with something, chances are someone else has too. If we are able to see those, and we can able to put things in place to hopefully reduce or eliminate those med errors. So, thanks.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.